ഗുഡ് മോർണിംഗ്. ഓസ്കി വിത്ത് ബിമൽ എന്ന എൻ്റെ ചാനലിലേക്ക് സ്വാഗതം. ഇന്നത്തെ ഡിസ്കഷൻ ടോപ്പിക്ക് ഓസ്ട്രേലിയൻ ഓസ്കിയിൽ ഉള്ള മെഡിക്കേഷൻ അഡ്മിനിസ്ട്രേഷനാണ്. മെഡിക്കേഷൻ അഡ്മിനിസ്ട്രേഷൻ ഈസ് ദെയർ ഇൻ UK scenario, Irish scenario and Australian scenario. But there are certain fundamental difference in the Australian scenario. So we will look into that. Okay. And on top of that, we will be talking about the special precautions that you have to follow in case of Australian scenario. Okay, welcome to the channel. As usual, you will be getting a 2-minute reading station will be there. So there is a reading time will be there. Usually you will be getting a reading time in a tablet. So you finish your reading, there is a scenario will be discussed. So your task, there is a storyboard like scenario will be there. And your task is to give medicine at a particular time. That's very, very important. Okay. So 8 o'clock medicine has to be given as per Australian nurse practitioner standards. So that will be the task for you. Okay, the second bell, my suggestion is before looking for second bell, you read it for 1 minute and you make a plan for yourself before you are going to enter the station. That's very important. Because in the station there can be some unusual scenarios will come up in front of you. Sometimes patient will not be talking to you, will not be interacting with you. Sometimes patient is worried about some other things, so these things you have to manage. So even if I'm giving all these instructions, sometimes some unusual scenarios will come up in front of you. There can be surprises that's hidden over there, and the examiners have always surprises. So they want to surprise you with some unusual scenarios that will come in front of you. My suggestion is you behave as if you are a nurse over there, okay, and this is the patient. So what you will do in real scenario if this happens? Just think of that side and then you behave accordingly. Okay, so 2 minutes reading session is over. Then you are entering the station. You are knocking the door and you are entering. First, looking for scene safety, that's very important, and manage the safety, that's very important. There can be some safety issues that is brought deliberately over there. You have to look for that and you have to manage it. And the next one is you have to look for you have to provide privacy and dignity. And next one is you have to go for a hand rub application. That is 7 steps of hand rub application. That's very, very important in every session. Examiner will look for that. Okay. Next one is you have to introduce yourself. And then the next one is you have to look for patient's name, patient date of birth, and confirm with your cardex or patient's file will be with you. So you confirm with the patient, then you confirm that patient safety has done it. Then the next job is you have to look for allergy status and pain status. So if the patient is having allergy, so look for allergy and then you manage allergy. Okay. And the next one is you have to look for pain and you have to manage pain. That's very important. If the patient says I don't have any allergy and I don't have pain, okay, thank you very much, happy with that, then you proceed with the next step because you don't have any time over there, only 8 minutes are still left over there. Then you have to talk to the patient, the purpose of visit. So purpose of visit is myself is here to give 8 o'clock medicine. 8 o'clock that particular tablet, for example, a Randac tablet is for you at 8 o'clock. So I am here with the Randac tablet. That's okay. Can I proceed? You can look for a general consent. Then next one is you have to look for a few more things. One is you have to look for swallowing difficulty. Then you have to look for whether the patient had food. So Australian standard is all the medicines has to be given after food. Otherwise it is exceptionally written over there. That has to be given in fasting. So generally all medicines are given after the food. So otherwise it is stationed separately, that has to be given in fasting. So you have to look for whether the patient had food. That's one thing. The next one is you have to lift the patient up into a higher position. If patient is already up, that's okay, you prompt that because the examiner is looking for whether you are going to address that issue. You prompt, I am going to lift you up in order to make for a good swallowing. Okay. The next one is the swallowing difficulty. That point I have to mention one more time. Sometimes there can be a scenario will come up in which the examiner will say swallowing difficulty is there. Okay. So your job is examiner will be prompting for the patient or the actor will be prompting for himself. There is a scenario will come up in which a patient is having swallowing difficulty. So you have to say sorry, but the patient's name, for example, patient's name is John. Sorry John, I can't give you the medicine right now. My job is I have to talk to the doctor and I will come back to you, and I have to change the medicines accordingly, depends upon your swallowing status. Okay, so this decision you are going to take, because examiner is looking for whether you are going to take this decision. That's very important. Once you took the decision, the examiner will say, okay, go ahead. That means the examiner is looking for whether you are going to take that decision at this stage. That's all. Okay, so that's it in the initial part. Thereafter, I talk to the patient or let the patient know I'm going to get the medicine and I will come back to you. Okay, then move to the other side. Beside there is a table will be there, in which there is a cardex will be there, and there is a medicine either strip or medicine there is it's coming in a small bottle over there. Some of the medicines in the bottle have a child lock, so be aware about the child lock. So you have to press, or you have to make sure that the arrows are aligned, then only you can open it. Then straight away what you have to do is you have to do a hand rub and you have to start checking the cardex. So read the cardex from the demographic data and make sure that the cardex is being checked in every aspect. I'm not going to look into everything about the cardex checking. So once you have checked and you have read out and everything is okay, you feel that your cardex is okay, read out the prescription and everything is okay. Now take out the medicine. So there is a medicine will be either in a strip or medicine in a bottle. So read out the medicine name and the medicine's expiry date and the dose has to be read out. Okay. Then if you are happy enough with all these prescription, you compare with the prescription and the medicine, and if you are happy enough, take the prescribed tablet or the medicine. Sometimes syrup will be there in a medicine cup. Okay. Sometimes there will be syrup is available. And there is a syringe will be provided for you. That's the oral syringe with a spout will be provided for you, so that you yourself can take out the medicine and put it in a medicine cup. If it is a tablet, make sure that you are not touching the tablet and you pop it in the medicine cup. If it is a tablet in a bottle, you have to make sure that the bottle is opened and then took out the prescribed tablet. Once that is taken out, then next your job is you have to close the box if it is needed. Or if it is a medicine strip, there is no need for closing. So once that is done, then you go back to the patient side with a glass of water and a cup of straw. A glass of water and a straw over there. Okay. Once that is done, now your job is you have to approach patient for second time. Here examiner is looking for how you are going to maintain the relationship, because already you have established relationship with the patient and you are going to maintain the relationship or not. That's what examiner is looking for. So you introduce the patient as if it is you are a friend with the patient, and then so talk to the patient. I am here with your tablets. My tablets is ready for you. Okay, and when you are talking about tablet, you just prescribe the time as well. This is the time of the tablet. I am going to come with the tablet. Then next one is get permission from the patient and ask the patient, can I double check your ID band first for a second time, because the policy says like that. Sometimes patient will be angry because you know myself and why you want to go for a second check like that. Patient will be sometimes angry, but you have to let the patient know, you have to talk to the patient. So that's the policy over here. We do not force patient safety. We have to check the patient ID for second time. So read out the cardex and then you have to confirm the patient, okay, with the cardex and ID band. I have tell you some more points at this stage. For oral medication administration in Australian scenario, there is no double checking with the second nurse. Okay, but in case of some medicines like warfarin and steroids, the second checking is advised. But all injections are second checking. So if the second checking is going to happen, for example, warfarin is here, so you have to prepare everything and you have to call for a second nurse to come in for a second check. Okay, once the second check is done, then you move to the patient side. Then again ask for the second nurse to come in for a second ID check. Okay, when the second ID check is done, then next your job is you have to explain the medicine about the patient. Talk to the patient what benefit he is going to get with the medicine, rather than talking the side. Do not highlight the patient. Highlight the side effects of the patient. If you are going to highlight the side effects of the patient will be anxious and patient will be too much worried about this medicine. So you should not do that. Okay. So if at all side effects are there, talk to the patient. There are some minimal side effects will be there, something like this way. So if at all happens, press the bell. I will come back to you straight away. I will keep an eye. Okay. Then you approach the patient. Once you have confirmed with the ID and you have explained the medicine to the patient, side effects to the patient, then your job is you have to offer the tablet for the patient. In case of a mannequin, you can offer a tablet towards the mouth, and then can offer water towards the mouth, and then ask the patient to open the mouth and have a look at your mouth. And the patient, you assume that the patient had swallowed the medicine, and ask the examiner, can I sign in the card? Examiner, patient had swallowed the tablet. But in case of an actor, if you go with the tablet, the actor will say, yeah, taken. So don't approach or don't push the patient, actor at this stage, because it's already taken. Then talk to the examiner, patient had swallowed the tablet, and can I sign the cardex? So examiner will give you the consent, so you can sign the cardex. So you have to sign the cardex. The next one is, once you have signed the cardex, you have to talk to the patient. I have the bell over here. I will come back to you straight away. If you need anything, press the bell if you need anything. So that is to be done. Then open the curtains, doors and windows. This prompt it. Then next one is, there is no trolley in Australian scenario. If trolley is there, you have to make sure that trolley is locked. The next one is, you have to do a hand rub and say thank you to the patient and thank you to the examiner. Then you can come out. So this is the way you are going to do the Australian OSCE scenario medication administration station. It's not a big hassle over there. It's pretty simple than compared with the UK and the Irish scenario. There are multiple tasks will be given in UK and Irish scenario. This is a very simple scenario over there. We at MWT, we are conducting face-to-face training for Australian OSCE, UK OSCE and Irish aptitude, and also CBT, online CBT. If anybody is interested, please do contact us. Description number കൊടുത്തേക്കാം. ഞങ്ങളെ കോൺടാക്റ്റ് ചെയ്യുക. ഞങ്ങൾ ഫേസ് ടു ഫേസ് സക്സസ്ഫുൾ ആയിട്ട് ഞങ്ങൾ 2 years ആയിട്ട് ഞങ്ങൾ ഓസ്കി ട്രെയിനിങ് നടത്തുന്നുണ്ട്. UK ഉണ്ട്, അയർലൻഡ് ഉണ്ട്, ഓസ്ട്രേലിയ ഉണ്ട്. ഇൻ്റർനാഷണൽ ക്വാളിറ്റി ആയിട്ടുള്ള ഫെസിലിറ്റീസ്, ലാബ് ഫെസിലിറ്റീസ് ഞങ്ങൾക്കുണ്ട്. എൻ്റെ പേര് ബിമൽ, ഞാൻ അവിടുത്തെ ലീഡ് ട്രെയിനറാണ്. If anybody is looking for training, do please contact us. We will give you expert training. And the other one is, ഞങ്ങളാണ് ഇന്ത്യയിലെ തന്നെ ഓസ്ട്രേലിയൻ ഓസ്കി ചെയ്യുന്ന ഏക സെൻറ്റർ, and myself is the only trainer who is doing the Australian OSCE in India. അത് എനിക്ക് പ്രൗഡോടുകൂടി തന്നെ പറയാൻ പറ്റും. ഞാൻ സ്റ്റുഡൻസിനെ 100% റിസൾട്ടോടുകൂടി ഞാൻ പാസ്സാക്കുന്നുണ്ട്. That is keep on going. So thank you for listening to us. And before concluding, I have a few things for yourself. ഈ സെനാരിയോയ്ക്കകത്ത്, if you are going to make some mistake at some point of time, so for example, you skipped some steps. So what's going to happen is, if you feel that you skipped some step, then you have to prompt the examiner. Examiner, I made a mistake over there. I skipped that step, and ideally I have to go through that side while I went through the other side. The examiner will definitely appreciate that, because you are identifying that mistake. That's what examiner is looking for. Then there are huge errors are happened. Then your job is, you have to talk to the examiner, so that the examiner will give you a second chance at sometimes to finish that step itself. Okay, always make sure that you are going to finish this scenario in 8 minutes time. It's a simple station. You can finish it, and you document it before you come out of the station. That's very important. ഞാൻ ഓസ്ട്രേലിയൻ ഓസ്കി സെനാരിയോയിലെ കാർഡക്സ് മാർക്ക് ഷീറ്റ് ഞാൻ എക്സ്പ്ലെയിൻ ചെയ്യുന്നുണ്ട് അറ്റ് സം സ്റ്റേജ്. സോ എൻ്റെ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക. അതുപോലെ നിങ്ങൾക്ക് ഈ ചാനലിലുള്ള ഈ സെഷൻസ് ഇഷ്ടമായെങ്കിൽ നിങ്ങൾ ലൈക്ക് ചെയ്യുക. അതുപോലെ നിങ്ങളുടെ ഫ്രണ്ട്സിന് ഷെയർ ചെയ്ത് കൊടുക്കുക. ഈ സീരീസ് ഓഫ് സെഷൻസ് ഓസ്ട്രേലിയൻ സെനാരിയോയിലും ഐറിഷ് സെനാരിയോയിലും UK സെനാരിയോയിലും എടുക്കുന്നുണ്ട്. സോ ഞാൻ അതിൻ്റെ അകത്ത് സ്റ്റെപ്പിലേക്ക് പോകുന്നുണ്ട്. ഐ ഗോയിങ് ടു ഡീപ്പ് ഇൻസൈഡ് ദ സ്റ്റെപ്പ് ആൻഡ് സീ വാട്ട്സ് ഗോയിങ് ടു ഹാപ്പൻ ഇൻ ദ സെനാരിയോ. നിങ്ങൾ ആ സെനാരിയോ ഇപ്പോൾ എന്ത് ചെയ്യണമെന്ന് ഞാൻ പറയുന്നുണ്ട്. സെൻറ്റൻസസ്, അതുപോലെ തന്നെ ബോഡി ലാംഗ്വേജ്, അതുപോലെ തന്നെ നിങ്ങളുടെ നോൺ വെർബൽ ക്യൂസ്, നിങ്ങളുടെ നോട്ടം, നിപ്പ്, approach, everything is considered for examination point of view. So everything is we are refining, and we are giving continuous language support until you finish your examination. So we are not just doing an OSCE training, but we will be behind you until you get pass. Okay, continuous WhatsApp support will be given, and also language support will be given. Your language will be refined to British Australian levels. Even if you pass your OET, your languages are pretty English. It's not great enough like British or Australian standards. So we'll bring up your communication strategies to British and Australian standards. That support is also given because of my so much years of experience in the UK Irish nursing system. So thank you very much for joining with this video. മറ്റൊരു ഇൻഫോർമേറ്റീവ് വീഡിയോ ആയിട്ട് next time I will come back to you. Thank you very much.